at 7:35. In the meantime, we turn our attention to another facet of the COVID-19 relief bill. There is a lot of big news regarding health insurance that will impact most of the folks right here in the Mid-South. And to help explain some of the most important changes, we're welcoming back our pal, Mr. Marlin McKelvy. He's president of the Consumer Directed Benefit Solutions. Marlin, good morning. Thanks for joining us. President signed the bill yesterday. What does that mean? What happened yesterday regarding health care?
Well, good morning, Tim, and thanks for having me back. Yesterday, President Biden signed the American Rescue Plan Act of 2021, and this legislation includes some really historic expansions of the Affordable Care Act that are going to dramatically improve or increase, at least, individual insurance access and affordability.
What are some of the most important details that our listeners ought to know about this piece of legislation?
Well, we could go on for hours, but certainly this legislation touches a lot of areas, Tim, and the expansion of both the size of the insurance premium subsidies that are going to be available and the elimination of what is called the subsidy cliff should be of particular interest to your audience. So first, subsidy amounts for individuals have been increased with the bill that President Biden signed yesterday. For example, a person making $19,000 annually, under the new rules, will be expected to be able to qualify for a free or virtually free silver-level health insurance plan, and that would include generous cost-sharing subsidies that would bring their deductible down to almost nothing.
Okay.
Second, instead of a person losing eligibility for premium subsidies when their income exceeds 400% of the federal poverty level, which for an individual this year is approximately $51,000, that has been replaced by a provision capping a person's insurance premium costs through the marketplace at no more than 8.5% of their annual income. So this will expand the eligibility for subsidized coverage to higher income individuals. For example, a family of four with two parents in their mid-40s and a couple of teenage children, and let's say they have an annual income of $150,000. Previously, they would have qualified for no subsidies, and under this new arrangement, they could see their premium cost reduced by a few $100s a month due to this 8.5% premium cost cap that has been implemented. And then, third, subsidy eligibility is being extended to persons currently on unemployment insurance in 2021. And their income will be assumed to be no higher than 133% of the federal poverty level, which just basically means that they will qualify for the maximum level of subsidies, available through the federal government's marketplace.
There's been such a flurry of activity. Marlin McKelvy joins us this morning on Wake Up Memphis. There's been a flurry of activity that has been really set up by this rescue plan, the stimulus, this $1.9 trillion across the spectrum on so many things. There's going to be a lot of changes. There's going to be a lot of money flowing here, there, and everywhere. And healthcare has always been very confusing on premiums and on, the deductibles. And now we're talking about subsidies. What kind of advice? I mean, that's a lot of information. I mean, you've given us a lot to chew on this morning, Marlin. What should somebody do? Because this sounds like this is going to impact millions of folks. What should people do? Because I would suspect just simply knowing what you have at your disposal and how much you might be out of pocket is always going to be critical. What steps should people just be taking if they're curious, or if they have some medical treatments that they anticipate coming up in the near future?
Well, those are all very good questions. And actually, during this special enrollment period that has been declared, people that are already enrolled in coverage can review. And in fact, with these new subsidy rules in place, someone that enrolled in coverage for January 1st will be finding that their subsidy will be getting adjusted. So people may be wanting wanting to choose a new plan based on changing circumstances. So, yes, you're right. There's a lot to go into. The good news is people have until May 15th to select a plan through the marketplace or to change their current coverage in the marketplace. And so for more information or online enrollment services, I have set up a site that's called enrollmetn.com. So that's ENROLMETN.com. Or they can call me at 901-219-8835. And I'll be happy to answer their questions and guide them through this rather complicated maze.
So they would get to talk to the guy they heard on the radio then.
That's right.
All right. Well, very cool. Well, Marlin, thank you so much for joining us this morning. Marlin McKelvy, the president of Consumer Directed Benefit Solutions. Thanks for your time. Thanks for breaking that down. There's so much that's in this bill. Healthcare is a critical component of not just that bill, but of everybody's lives. So thanks for bringing us some of that knowledge right out of the gate. President Biden surprisingly signing that yesterday. We thought he was going to sign it today. So appreciate you coming on short notice, Marlin.
I appreciate it and look forward to visiting with you again soon.
Sounds like a plan. Thank you so much. There's Marlin McKelvy on Wake Up Memphis. It is 7:27 and speaking